Hello, good morning. Yes, today we are going to discuss about prostate enlargement. In prostate issues, there are two conditions. We have enlargement, we have cancer. Today we are going to discuss about enlargement. Tomorrow we talk about cancer. Okay? So, when you talk about prostate enlargement, is a condition whereby the prostate gland in the male organ starts enlarging. Sometimes it can start breaking and form different lumps, okay, which most times most people go for operation. But what I'm trying to teach you today is how to detect it coming, okay, and how to prevent it so that you won't learn to surgery. The fact is that normally it's men above 60 years that should suffer such things, but presently now younger men are facing it. That's irony, that's the alarming condition, okay. And for that reason we saw need to start educating people seriously on how to prevent it, because most younger men, they ignore the symptoms, okay, and some of them don't even understand that what they are seeing is a dangerous situation, and they just take it lightly until when it turns to an emergency condition. And when it turns to emergency condition, the faster way to handle it is surgery, but there are solutions better than surgery. Okay, that's what I'm trying to teach you today. First of all, I need to inform you on the symptoms. Okay, the symptoms has to do with sometimes increase in urination. Okay, that's increase in urination, and sometimes you find it pain while urinating. Sometimes you can't empty your bladder completely. You just you feel like urinating and you just go and urinate small, you come back. Okay, another symptom could be blood in the urine. Another symptom could be like trembling after urinating, be like you're still jerking because the bladder is not empty. Some of the symptoms as well is interruption in your sexual ability. Okay, the danger is if untreated, so many things that is dangerous with setting, like inability to urinate at all, total blockage sets in. Things like urinary tract infection can come in, bladder stones sets in, bladder damages sets in, and kidney damage sets in. So when you're having all the symptoms and you don't go for treatment, this thing sets in, and when it sets in it becomes a critical condition. Okay, now I want to tell you that the dangerous part of it is that most youths overlook these symptoms. They don't see it as anything. They just be doing what they think they should be doing, which is wrong. At the end of the day, the condition becomes difficult. Okay, so what I'm trying to tell you now is lifestyles you should embrace or adopt so that you would not find yourself in this condition. And even if you're already having the symptoms, those I'm going to explain to you now will reverse it and give you a better lifestyle. Remember, this is not a medical solution. It doesn't stop you from seeing your doctor, but I'm just educating you on how to live safer and better. Initially, surgery was the solution, but presently, there are so many other solutions outside just surgery. Okay, now I want to mention to you about 4 to 5 vitamins you need to make sure you add to your system daily. These are natural ways you can prevent, and these are natural ways you speed up your healing. Okay, so I will call the vitamins and I will tell you one or two quality they all have that makes prostate not to develop further and helps it to shrink. Okay, like now you need vitamin D. Okay, I will see mention to vitamin D. You can get the supplements or you can see get it from food. foods with vitamin D happens to be egg yolk, salmon oil, salmon fish, and another source is banana. Okay, then milk as well. You can still get it from milk. Okay, these are sources you can get vitamin D: banana, sunlight, milk, and salmon fish. The next is vitamin C. Vitamin C, you get it from oranges and vegetables. It's called ascorbic acid. Like what we discussed yesterday, is very much in lemon. Okay, then you still need vitamin E. There are so many supplements with high vitamin E. Okay, now there is a particular thing that vitamin E, vitamin C, and vitamin D carries. These three vitamins, okay, and zinc oxide as well. But I'm not talking about zinc today. We will treat it when we're talking about prostate cancer tomorrow. This vitamin E, C, and D, there is this quality they have. They are antioxidants. They don't allow free radicals to form. Okay, because free radical damages our cells, and anything that causes damage to your cell helps enlargement, helps abnormality to set in. Okay, it does not allow free radicals to form in your system. Then the second one is that is all of them, they are all anti-inflammatory. They have anti-inflammatory properties, so they don't allow something in your body to they don't allow growth. Is the summary of it. They don't allow growth in your body system, and anything that has anti-inflammatory properties does not support growth, which means their presence in your body system cannot allow prostate enlargement. And if there is prostate enlargement already, they help to shrink it back. Are you now getting the need to carry all this, to have all these nutrients in your body? Now, there is an expo I'm going to give you. Our day-to-day intake, food intake, might give us a good quantity actually. But if you can get to any supplement that has these vitamins, that will be more raw for you, and that will give you a quicker result. Take care of yourself while we talk about prostate cancer tomorrow. Remember to share this to everyone, because prostate is becoming more common than malaria.